In the Black Hills region of western South Dakota, Blair Brothers Angus has a history dating back to the early 1950s. Today, the family operation sells more than 450 bulls by private treaty each year.
U.S. Premium gave us a market that we were looking for and a market that we could hit, and gave us a breeding objective, breeding good high carcass characteristics, high marbling cattle that you can get paid to do. It doesn't cost any more to run that cow, and you're adding value to the calf. I mean, we've also kept the herd very maternal and focused on having really good cows for our environment, but we've also, bred for that marbling and bred for things that'll do well in the feed yard, that'll feed and grade. They have to look good, they gotta be high marbling, they gotta be heavy muscled, they have to have good feet, good udders. We just don't have time to mess with the individual when you're trying to, run the whole herd.
Producing top quality bulls and cows means the team at Blair Brothers has to have a sharp focus on herd health. Because of that, they are believers in the value of a comprehensive vaccination program.
We've been pretty high proponents of keeping a good vaccination program and keeping those cattle vaccinated and their boosters in them.
Vaccinations to me are absolutely critical in maintaining herd health. I mean, if we do not have a healthy product, our cattle are not going to perform up to their genetic potential.
In spite of their efforts, a few years ago, the Blairs experienced a Pasteurella outbreak in their young calves close to branding time. Their veterinarian recommended they use once PMHIN, an intranasal vaccine, to treat their calves.
In Britton's case, they knew they were dealing with Pasteurella maltosida. He worked with his veterinarian. They decided that once PMHIN would be a really good fit for them, and they implemented it into their vaccination protocol. Herd immunity is critical to overall herd health, and we can use intranasal vaccines in very young calves to stimulate their immune systems, even while they've got maternal antibody from colostrum on board. And then as those calves get older, we know that they respond better to the injectable vaccines, the parenteral vaccines, so they'll get a little bit of a memory response when we vaccinate them at a later age, which helps increase their antibody level, makes them more resistant to disease, and gives them overall better herd health.
The value of the Blair Brothers vaccine program is clear. Even with a tough weather year in 2019, their calves stayed clear of any disease problems.
And this winter was real tough. It was really cold, and then we got wet and had a ton of wet snow and kind of muddy conditions. And before the calves even got sick, we got them in and got that intranasal in them, and I think it really prevented a lot of sickness with all the wet, tough, muddy conditions that we had this spring.
Working with producers and veterinarians and seeing the results of once PMHIN has been very impressive to me. I mean, there's a lot of people that have implemented it into vaccination protocols and have seen very good results with the product. Once PMHIN is a good fit because it does have the dual strain, both Mannheimia and Pasteurella bacteria in it, and it's safe to give to calves as young as a week of age, so it can be given virtually at any time during that calf's life.
Dr. Thompson says one of the keys to keeping a vaccination program working best and making sure calves stay healthy is regular consultation with a veterinarian.
I think they need to evaluate with their herd health veterinarian at least on an annual basis, or if they have a disease challenge, then I think they need to evaluate it again. And it's always good to get the local vet involved, get some diagnostics done to find out exactly what problem they're having, and then see if they need to make any changes in their vaccination protocols. The local vet is their best source of knowledge for the problems that happen in their area. If they know the whole herd, nutrition, management practices, they're the best ones to help guide a producer in making vaccine decisions as well.
Vaccines are just a great tool for producers to use, and I think you have to use them. We never have a health outbreak anymore because of vaccinations, and if you're selling them at the sale barn, you're going to take a discount without them. There's something that you just have to do, and it's going to return every time. Calves we borrow out of the sale barn, I try to bring those home and hit them with nasal gin that night or early in the next morning, and we even bought some put together calves that have had, very little sickness because of that Nasalgen, just getting it in them right when we get home.
And like most everything else on the ranch, getting the most benefit from a vaccine program comes down to planning ahead and having a set protocol that delivers what the calf needs at just the right time.
Timing of vaccines is really ranch specific. A lot of it just depends on when they can handle those calves. If you have a ranch that historically has issues in real young calves, they're going to probably come in that first week of life with some intranasal vaccines. If other ranches that never see problems until later in the summer, more towards weaning time, then branding time is going to be the time to come in and give those intranasal vaccines.
A healthy calf's growing, going to put more pounds on, and just not having to go doctor anything all summer is a huge time savings, and have 0 death loss during the summertime is always a bonus.
Reporting from South Dakota, I'm Matt Fleck for NCBA's Cattleman to Cattleman.